What's the difference between the traditional method of EMDR and using a product like SenseTech? What's the difference between EMDR full stop and then using EMDR with SenseTech?
Okay, well, when Shapiro sort of developed EMDR, the issue of bilateral stimulation is something that she did spontaneously. She was just aware of her eyes moving from side to side. Now, this is a very similar mechanism that we all do when we sleep. We go through a very important part of sleep known as rapid eye movement sleep. And we believe that this is very vital as a form of brain nourishment, but also helpful to allow the brain to file away or process experiences. When we engage in that rapid eye movement, because we're asleep, it's a completely involuntary, unconscious movement. So what Shapiro discovered is the fact that if you get people to do bilateral stimulation for themselves, it's very difficult. The vast majority of people can't do that. Or if they did, they almost require so much working memory to be able to perform that task, they're not then able to do anything else. So Shapiro came up with this idea about, well, what would happen if you just gave people a stimulus? So, traditionally in EMDR, the most frequent stimulus we would use would be just our hand, which would be getting the client to think about their trauma memory and the characteristics of that. And we would get them to think about that memory, and at the same time we get them to focus on our hand, and it involves bilateral stimulation like this.
Hence the movement.
Yeah, so and that creates a distinct bilateral stimulation. What's interesting though is the part of the brain that this really connects with is a part known as the thalamus. And as an electronics person, you'll know that that part of the brain works a little bit like a relay station. It passes information to various parts of the brain. But that relay station gets three types of data, three types of input, if you like. And that is, it gets visual data, it gets acoustic data, and it also gets tactile data. And this is why, from an EMDR perspective, we can do bilateral stimulation in either of those three ways. We can do it visually, we can do it acoustically, or we can do it tactile, or combinations or variations of the three.
How have you found the benefits from using standard EMDR, which is obviously a technique, as opposed to using a piece of equipment like we manufactured, the SenseTech?
Yeah, well, when we're training people in EMDR, one of the differences between EMDR and maybe cognitive behavioural therapy is that we often say is that some EMDR therapy sessions can be much longer than the traditional CBT therapy sessions. So it would not be unusual for an EMDR session to last around about 90 minutes. What some EMDR therapists experience is the fact that if they're doing bilateral stimulation traditionally, for long periods of time, it can be extremely fatiguing for clinicians. Most EMDR therapists are working in very intense environments where they may be seeing 4, 5, maybe 6, clients per day. And what we've found is the fact that actually when you're doing EMDR in that traditional way, that's exhausting. So the equipment has a distinct advantage in terms of the fact that it certainly helps dramatically with therapists' fatigue levels. The second advantage is the fact that we mentioned before about the fact that we can do bilateral visually, acoustically and tactile. But sometimes with clients we might need to move between each of the three. And one of the advantages of the equipment is the fact that enables us to do that much more efficiently and much more effectively. The reason why this is relevant in therapy terms is because the language we use in EMDR therapy is that if a client is processing, then you want to keep going. You want to try and stay out of the way of the process as much as possible. And therefore, you know, we want to use some of the equipment because there are times when it helps us to do that. The real work in EMDR therapy goes on inside the person's own brain, you know, and that's because we already have those natural information processing systems in place. What this equipment does, it just activates that in a very effective, very, very efficient manner.